Hi, thanks for joining me. I'm Dr. Pam Terrio from Alleviate Dry Eye, where you can learn to take care of your eyes like it's the only pair you'll ever have. Today, we're going to be talking about 9 tips to alleviate your allergy symptoms when your eyes already feel dry. So, the first is to decrease how much pollen is on, in, and around your eyes. I wrote a blog about this last week, so you can find out more information there on my website at www.pamterrio.com/blog/55. We've got 3 tips to eliminate the pollen around your eyes. Number 2 is to rinse your eyes. So if you've been outdoors or maybe in your Aunt Myrtle's living room with her 14 cats and you know there's something hanging around that you're allergic to, go ahead and just rinse your eyes with some artificial tears when you're out of that environment. If you don't know which tears would be best for you, I always recommend preservative-free, and you can also download my artificial tear guide. I'll put a link to that down below. Number 3 would be to use a cool compress. Now that's going to help cut down on any inflammation that you might have because it's allergy season, so swelling of the lids or swelling of the tissues of the eyes themselves. You could do that with a wash rag that you got wet and then put in the refrigerator. Leave that over your eyes for a couple of minutes to relieve the swelling. During this allergy season, tip number 4 is to perhaps skip your warm compress. If you use a warm compress as part of your normal dry eye routine, then you might want to leave that out for a couple of days or weeks when your allergies might be acting up and your lids are swollen. Number 5 would be to cleanse your eyes. So if you've been outdoors or again in an area where you know there's been an allergen, make sure that you get the pollen off of your eyes before you go to sleep at night. I recommend 2 different eyelid cleansers. For people who have very sensitive eyes, this hypochlor spray is great. You just make sure your lids are free of makeup and then close your eyes, squirt, squirt, rub, rub, rub right into the lash line, and that'll remove the pollen. The other one I love is called We Love Eyes. This is their tea tree foaming eyelid cleanser that you just give a pump onto your finger, rub the 2 fingers together, and then concentrate right there at the lash line to remove that pollen before you go to bed at night. Number 6 is to avoid taking an oral antihistamine. So if you're having allergy season, allergy symptoms, think to yourself what's bothering you the most. Is it your sneezing and stuffy nose? Maybe you could get by with just using a nasal spray. Or if it's that your eyes are red and itchy, then by all means, take a topical antihistamine. Instead, you can skip taking an oral one, which would bring down, which would cause your eyes not to produce as many tears when you take an oral antihistamine. Okay, tip number 6 is to use an allergy eye drop. And great news, one of my favorite prescription allergy drops was just made over the counter. You can now get Pat-A-Day at the drugstore without a prescription. So Pat-A-Day is a once-a-day antihistamine eye drop that you should put in your eyes in the morning time. If you're a contact lens wearer, make sure you put the antihistamine drop in before your contact lenses and wait 10 minutes before you place your contact lenses. And like I said, this is just FDA approved as an over-the-counter medication, so you can find it at your local drugstore. Tip number 8 is to avoid using a drop that gets the red out. Now I can understand that this time of the year, when your eyes look red and they're itchy, you might be wanting to use a redness relieving drop, but I would hesitate to do that because redness relievers often have vasoconstrictors in them, which could cut down on the nutrients that are being brought to your eye, and also you can have rebound redness when those drops wear off. And finally, tip number 9 is to avoid over-the-counter allergy drops that have redness relievers in them. So things like Visine A is for allergy, Visine Allergy, Opcon, Nafcon A, these all may have an antihistamine in them, but also contain a redness reliever. So the same would apply, that it's going to give you some rebound redness afterwards. And those drops are prescribed every 4 hours. So that's a ton of preservatives going into your already sensitive eyes. So thanks again for joining me. During allergy season, it's best to get those pollen and allergens out of your eyes. So again, look below. I'm going to make a comment of the artificial tear guide that you can download and find which tears would be best for you. As always, you can find out more about dry eye at my website, www.pamterrio.com, or you can visit me in the clinic at Lusk Eye Specialists here in Shreveport, Louisiana. Remember, we need to take care of our eyes today so that our vision will last us a lifetime. Thanks again.